Now, as several nations struggle to cope with COVID-19, South Korea seems to have it under control. Despite an early explosion of cases there, the country's swift response is being hailed a success for keeping the death toll to a minimum. So how did they do it? Well, in a moment, I'll speak to a member of South Korea's Health Advisory Committee and ask how his government flattened the curve and escaped what could have been a catastrophe. But first, Natalie Perhonen has this report.
On January 20, South Korea declared its first case of the coronavirus. At the end of February, it had the largest outbreak outside of China. But South Korea is now widely considered a leading example of how to manage the crisis. Within days of that first case, the health ministry promised an all-out response to tackle the virus. And for a few weeks, the country appeared to have the situation under control. But then, patient 31, a woman with a fever, attended a service of a religious sect in Daegu with about 1,000 other worshippers. That encounter led to a wave of new infections. Daegu became the epicenter of Korea's outbreak. The country appeared on the verge of disaster. But the government and health authorities responded with a comprehensive campaign of testing, tracing, and isolation. They used CCTV and cell phone surveillance to track down contacts of confirmed cases. Residents would be sent messages to inform them if someone living or working close by had the virus. Social distancing rules were also introduced, but the country never went into a lockdown. It even went ahead with parliamentary elections in April. Health authorities later said there wasn't a single case of local transmission caused by people going to the polls, despite the highest voter turnout in nearly 3 decades. At one point, the country declared no new domestic cases. But even here, there have been flare-ups. There was a new cluster linked to clubs and bars in Seoul earlier this month. The need for vigilance hasn't gone away. South Korea turned from a global hotspot to a model of success. It didn't happen by chance. The public and public institutions have been down this road before, dealing with SARS, the H1N1 epidemic, and an outbreak of MERS. It's taken lessons from those emergencies to make sure agencies have the flexibility and authority to react quickly. And it's now urging the international community to give the World Health Organization greater powers to do the same at a global level.
We must update the WHO international health regulations and other relevant norms and augment them with binding legal force. A novel infectious disease could emerge at any time, and we must be able to respond more quickly and effectively.
But will South Korea's plea for solidarity succeed? Natalie Perhonen, The Newsmakers.
Well, to get more on this, I'm joined now from Seoul by Dr. Soonman Kwon. He's a member of the South Korean government's Health Advisory Committee and the president of the Korean Health Economic Association. So good to have you on the program. Would you consider your government's reaction to, response to COVID-19 as a success?
Yes, I think so.
Yeah. What do you think was the main reason for that success?
I think it's a very early and quick response. That's the key. Then the next question can be, what made the Korean government respond very quickly and early? I think one of the major factors is the policy learning from the past. About 5 years ago, we had a so-called MERS crisis. And at that time, Korea had the largest mortality outside of the Middle East from those MERS. So it gave us good lessons to learn. And so Korea had a kind of good preparedness for this type of infectious disease outbreak. So it's like a fire. If you respond early and succeeded in containing the small fire, then you can avoid the overflow of patients in the healthcare system. But if you failed in the early stage, then there's a surge of patients, and I think no healthcare system can cope with those huge number of patients. So I think early response is very important. And in addition to this early response and preparedness, another very important factor, I think, is the flexibility, because this is a new disease, and there are a lot of uncertainty there. So even if you are very well prepared, there are some components that are still uncertain. So you should be flexible enough to adjust the existing policy levers to the changing environment and to the changing or emerging scientific evidences. So I think that those are the keys.
Dr. Kwon, there's some countries in the world right now where they're even debating as to whether social distancing even works. They're debating about very basic things, whether masks work or not. Would you attribute that to the fact that, unlike South Korea, they don't have that cultural memory or that historical memory of things like SARS and MERS, so this is new to them, and therefore all options and all opinions are on the table, and they're wasting time debating things that shouldn't be debated?
I think so. First, face mask, I believe that it's a very cost-effective measure. And face mask is not a very expensive one. So from an economics perspective, the cost is very low, but effectiveness, even if you want to discount the full effectiveness of face mask, but still, I think overall it's very cost-effective measure to cope with this COVID-19. Even in Korea, there are some cases that there's a drastic difference in infections for those who wear face masks and for those who don't, although majority of the Koreans wear a face mask. So that is very clear. Second issue, social distancing. I think is also true, especially in the early stage, because this is infectious disease, right? So if you keep enough distance among people, then we can definitely manage the rapid spread of this infectious disease. But at certain point, we cannot push forward this social distancing forever. So at some point of time, we need some kind of exit strategy, taking into account benefits and cost of social distancing.
Right, and with that exit strategy and trying to be in this, as you call it, flexible scenario or even agile scenario. So things are opening up and you're sort of containing the virus or largely containing the virus, and you're agile enough to be able to react and respond if a second wave hits or if this sort of explodes again, right? A lot of people have anxieties that can only happen in an unfree society. A lot of your freedoms have to be handed over to the government in order to be in that situation.
Well, it can be controversial and there might be contextual issues. So in the case of very aggressive contact tracing, yes, it is fully accepted in Korea and it is based on law, kind of a emergency type provisions, because in general, Korea is a very strong privacy protections. But after the MERS crisis, we revised the communicable disease control law, and the new law, revised law, says in a health emergency, the government can have this type of aggressive contact tracing and disclose the information to the population, to the public. So it is still even this, of course we have this legal arrangement, but still even now, when we have a public survey, I think more than 80, 90, about 85% of the public support this type of contact tracing and disclosure of the information to the public. So it should be based on the legal basis. So it's culturally okay, but I'm not sure whether other countries like the US or some European countries, whether they are willing to accept this. I think it should be based on their own context and social consensus.
Dr. Soonman Kwon, really good to get a deeper insight into the situation in South Korea. I thank you very much for joining us here on the Newsmakers.